Manana si Zeus, to all my colleagues here, many of God's blessings. Imina 35 na legislature in Guam is called to order. For the prayer at this time, I'd like the good Senator Mary Camacho Torres, could you kindly lead us in prayer? Colleagues, please stand.
Ani Tata i Lehina Dani Spiritu Santo, Amen. Zeus Tata ni Tora Hanat Sinya. Ekungo ki tinatazud Mami. We offer this prayer for all those who are ill during this pandemic and for the families suffering from their losses and disadvantages. As we near the celebration of All Souls and All Saints' Day, deliver unto us, dear Lord, the promise of your love and mercy. We pray also for our leaders and essential workers. Bless them with abundant courage, strength, and wisdom during these trying times. Satbe Regina. Si Zeus and Gwinegwi Rina Zananan Minaasi, Ilinatla Zaminamis, Zininangan Mami, si Zeus and Gwinegwi. Haguna agang ni man mandilas tiladun famaguun eba. Hagu in tatanga manuugong zamanatangis ham gwinig isagan lagu. Gusinay pues saina abugadan Mami, lek magi and now imanzo asi fanatanmo. Sa después de este iman ma destiladon Mami, na li ham nu imatunan ni finagumo as Jesus. Asay na senzo asi, asay na nadzinuusan, asay na mamis na sempre Birhenas Maria. Sa zuzuti ham santa na ng Zeus, para imiresi kumusiki iprinimeten isaynata es Jesu Cristo. Amen. Ginaani Tata ilahina sa ni Espiritu Santo.
Si Zeus Mahasi, Senator Mary Torres, for the recognition of Milazan Mastaklu na sacrificial. At this time, I'd like to recognize Senator Regine Visco Lee.
Sidus Masi, Madam Speaker, and good morning, colleagues. On behalf of a grateful island and country, we honor Mess Attendant Second Class World War II Jose Sanchez Canata and the family of Mess Attendant Second Class Jose Sanchez Canata for making the ultimate sacrifice in service and defense of our island and country.
Sidus Masi, Senator Lee, and Senator Lee, if you can please lead us in the reciting of the Inafresi.
Inafresi, ginini mastakulu ginasoku, imastakulung gikurasonhu, zani masfigu nani nasenyahu, kuufresen maisadzu, harabai pratahi, zani defendi, ihnengi, ikutura, ilengwahi, airi, hanum, zanitanu tamoru. Niran shaku diretu gininas Zeus Tata, estiu fitma gihilui bitlia, zani banderahu, ibanderan guahan.
Si Zeus Masi, Senator Lee, and at this time, for the singing of the Guam hymn and Chamorro and the national anthem, I kindly ask our gentlemen members to please lead us.
Kanogi Chamorro, Urikanota, Kantai Natunyanga Gitodu Ilugar. Para I honra, para I gloria, Aviva estás en para. Para I honra, para I gloria.
Mananasitus, Madam Clerk, Kaziman Gagi, Gwini, put for vote, roll call.
Senator Castro. Senator
None.
Lee. Senator Marsh Titano. Senator Moylan. Senator Munya. Speaker Munya Barnes.
Mananasitus, Kagia.
Vice Speaker Nelson. Senator Perez. Senator Rangel. Senator San Augustine.
Istigazu.
Senator Shelton. Senator Taidagui. Senator Pito Terlahi. Senator Therese Terlahi. Senator Torres. Madam Speaker, there is a quorum.
Sizus Masi, Madam Clerk. Assistant Majority Leader, Senator Marsh Titano, you are recognized at this time.
Sujus Maasi Maska Hulu. Madam Speaker, I move to approve the Legislative Journal dated September 15th, 2020, subject to corrections.
Colleagues, on the motion to approve the Legislative Journal dated September 15, 2020, are there any objections? Seeing or hearing none, motion carries. Assistant Majority Leader, Senator Titano, you are recognized.
Maska Hulu. There are communications and petitions. I move that they be appended to today's session journal.
On the motion that communications and petitions be appended to today's session journal, are there any objections? Seeing or hearing none, motion carries. Assistant Majority Leader, Senator Titano, you are recognized.
Maska Hulu. There are messages from E. Magahagan Guahan, and I move that they be appended to today's session journal.
Colleagues, on the motion that messages from Imagahagan Guahan be appended to today's session journal, are there any objections? Seeing or hearing none, motion carries. Senator Marsh Titano, Assistant Majority Leader, you are still recognized.
Maska Hulu. There are reports of standing committees, and I move that they be appended to today's session journal.
On the motion that reports of standing committees be appended to today's session journal, are there any objections? Seeing or hearing none, motion carries. Assistant Majority Leader, Senator Marsh Titano, you are still recognized.
Maska Hulu, there are no there are no reports of select committees.
Sizus Masi, Assistant Majority Leader, you may still proceed.
Maska Hulu, I move that bills introduced, bills number 399-35 COR through 418-35 COR, and resolutions introduced, resolutions 374-35 COR through 384-35 COR be deemed to have been given their first reading.
Colleagues, on the motion, are there any objections? Seeing or hearing none, motion carries. Assistant Majority Leader, I will still recognize you at this time.
Maska Hulu, I move to excuse those senators not present at today's session.
Sizus Masi, Assistant Majority Leader, on the motion, are there any objections? Seeing or hearing none, motion carries. Assistant Majority Leader, I'll still recognize you, please.
Maska Hulu, I move that all congratulatory, commendatory, and condolence resolutions introduced today and for the remainder of this legislative session be considered first read and adopted to allow the Legislative Council to make technical corrections and to add all senators as co-sponsors.
Colleagues, on that motion, are there any objections? Seeing or hearing none, motion carries. Colleagues, we are on legislative concurrence at this time, and I'll go ahead and recognize Senator Therese
Under
Tulai.
motions, Madam Speaker, if I may?
Yes, please.
Yes, thank you. The Committee on Health, Tourism, Historic Preservation, Land and Justice reported out the nomination of Anita F. Orlino as a member of the Guam Ancestral Lands Commission with the recommendation to do pass, and I would move that this be placed on the session agenda.
Thank you. Senator Lee, I'm going to go ahead and recognize you this time.
I apologize, Madam Speaker, but I believe the committee reports for Anita F. Orlino and several others from Senator Chalahi's committee have still not yet been placed online, and it's our practice that we have them at least online for 24 hours before they're added or before they have a vote. So I think there's still an opportunity for us to do that later in the week, but we're just giving CORE an opportunity to catch up on all of the bills and all of the many appointments that have been received in the last few weeks.
Thank you, Senator Lee. I was informed a little bit earlier that some of those committee reports did get turned in and were uploaded. So
This is one of them, Madam Speaker.
yes. So for the sake of making sure.
It's been uploaded. The clerks informed me this morning. It's been uploaded since Friday.
Okay. Thank you, Senator Chalahi. Clerk, can I have a minute with you? Senator Lee, thank you so very much, and thank you for bringing it up. I will inform you that based on the clerk's submission, that nominee is up online now. Thank you so very much. Senator Joseph Augustine, before we work on the motion, did you have an inquiry?
No, Madam Speaker, I have a motion, while we're in motion, to add a bill.
Yes, thank you very much. Colleagues, just as an FYI, as of early this morning and previously, I guess yesterday, a lot of the committee reports did finally get completed and cleared, and a lot of those are online. So it should be there on your drive. If not, just let the clerk or the sergeant of arms know, and the clerk can help us confirm that. So on the, thank you, CORE Chair, Committee on Rules Chair. So on Senator Teresa's motion to put Anita Orlino, sorry, on the session agenda, are there any objections? Seeing or hearing none, motion carries. Senator Teresa, you still have the floor on motions.
Thank you very much, Madam Speaker. I'd like to also report that the Committee on Health, Tourism, Historic Preservation, Land and Justice reported out the nomination of Ronald F. Eclavea as a member of the Guam Ancestral Land Commission, and I would move that that also be placed on the session agenda.
Si Diyos masi Senator Therese Terlayo on that motion for Ronald Eclavea. Hearing no objections, seeing none, motion carries. Senator Legislative Secretary first. Senator Shelton, I will recognize you.
Buenas noches, Madam Speaker. I move to place in the voting file from the Committee on Education, Air Transportation, and Statistics, Research and Planning the nomination of Liana Lynn L. Borja to serve as a member of the Guam Commission for Educator Certification with the recommendation to do confirm.
On that motion, are there any objections?
Liana Borja.
Seeing no objections, seeing or hearing none, motion carries. I'll go back to you, Senator Therese Terlahi. Do you have another one?
Under motions, Madam Speaker? No.
Yes, we're still on motion. She
No,
got
no.
Maria G. Cruz?
Is she on already? She's already on the agenda, Madam Speaker. Maria Cruz.
Thank you very much. I just got notified by the clerk. I'll go ahead and recognize Senator Joseph Augustine. You are recognized.
Thank you, Madam Speaker. I move to place Bill 215-35 CR as amended by the committee on the session agenda.
Can you please read the bill, sir, and who's introduced by?
Yes, Bill 215-35 CR as amended by the committee, sponsored by Senator Tello Taitagui, Senator Luis Muñoz, Senator Kelly Marsh Taitino, and Senator William Castro, and is an act to amend Section 6301 B, parentheses B of Article 3 of Chapter 6, Division 1, Title 5, Guam Code annotated, relative to maximum limits of government liability. Introduce Marcy, Madam Speaker.
Senator Lee, I will recognize you at the time.
Sujos Masi, Madam Speaker, and I thank Senator San Augustine for the motion. I just wanted to inform the body that Bill 215 was pending legal review that just cleared and it was just filed, so it has just now been placed online. So, you know, if we want to, I believe it was a notwithstanding motion, but just wanted to be clear that this has not been online for 24 hours as
Thank you.
has been our practice.
Thank you, Senator Lee. Colleagues, I will just take a moment's recess on that. I understand that the clerk needs to just verify on that motion, so just give me a moment's recess. Imina 35 na legislature ng Guam is back from recess. I will note, based on the clerk's recommendation to the speaker, the committee report has not been processed yet based on the standing rules. And again, because of that, we were assured that we will work the policy, but through the standing rules. And at this time, and unless the body has that recommendation, I will refer back to Senator San Augustine.
Thank you, Madam Speaker. Notwithstanding the House rules, and I understand that we need to upload it, but notwithstanding the House rules, because I know this bill won't be heard for the next couple of days. It'll give it enough time for everybody to be able to read it. By the time we get to it, it'll clear. So, notwithstanding, I move to place Bill 215-35 CR as amended by the committee on the session agenda.
On that motion, do I hear an objection? Hearing no objection? Or seeing none? Motion carries. Anyone else on motions at this time? If not, Senator Therese Terlahi, you are recognized.
Thank you, Madam Speaker. The Committee on Health, Tourism, Historic Preservation, Land, and Justice hereby reports out the nomination of Brian K. Artero to serve as a member of the Guam Ancestral Lands Commission with the recommendation to report out only. And I move that that nomination be placed on the voting file.
On that motion to place Brian Otero to serve as a member of the Guam Land Use Commission with the recommendation to report out, are there any objections? Seeing or hearing none, motion carries. Senator, Legislative Secretary Amanda Shelton, you are recognized.
Sedis Masi, Madam Speaker. I move to place in the voting file from the Committee on Education, Air Transportation, and Statistics, Research, and Planning the nomination of Gravinder Bik S. Sobti to serve as a member of the AB Wampat International Airport Authority Board of Directors with the recommendation to report out.
On that motion, are there any objections? Seeing or hearing none, motion carries. Legislative Secretary, I'm going to go ahead and acknowledge you for Liana Lynn Borja, please.
Sedis Masi. I did do Liana earlier. I have one more, though. Would you like me to repeat for Liana?
Yes, please.
I move to place in the voting file from the Committee on Education, Air Transportation, and Statistics, Research, and Planning the nomination of Liana Lynn L. Borja to serve as a member of the Guam Commission for Educator Certification with the recommendation to confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Senator Therese, I will recognize you at this time. Thank you, Legislative Secretary. Senator Therese, please proceed.
I move to place in the voting file from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of Maria G. Cruz to serve as a member of the Guam Ancestral Lands Commission with the recommendation to report out only.
On that motion, colleagues, are there any objection? Seeing or hearing none, motion carries. Senator Therese, I'll
Yes.
still recognize you.
Thank you. I move to place in the voting file from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of Leilani R. Flores to serve as a member of the Guam Land Use Commission with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries.
I move to place in the voting file, Madam Speaker, from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of Philip J. Flores to serve as a member, public member representative of the Guam Board of Medical Examiners with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Senator Perez, I'll recognize you at this time.
Thank you, Madam Speaker. I move to place in the voting file from the Committee on Environment, Revenue, and Taxation and Procurement the nomination of Stephen R. Hollister to serve as a member of the Guam Environmental Protection Agency Board of Directors with the recommendation to do confirm.
On that motion, colleagues, are there any objections? Seeing or hearing none, motion carries. Senator Therese Terlaje, you are recognized again.
Thank you. I move to place in the voting file from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of David T. Lotz to serve as a member, planning representative of the Guam Historic Preservation Review Board with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Senator Perez, you are recognized.
Thank you, Madam Speaker. I move to place in the voting file from the Committee on Environment, Revenue, and Taxation and Procurement the nomination of Rennie A. Lanetta to serve as a member of the Alcoholic Beverage Control Board with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Senator Perez, you still have the floor.
Sidus Masi, Madam Speaker. I move to place in the voting file from the Committee on Environment, Revenue, and Taxation and Procurement the nomination of Candy C. Oklahoma to serve as a member of the Alcoholic Beverage Control Board with a recommendation to do confirm.
On that motion, colleagues, are there any objections? Seeing or hearing none, motion carries. Senator Therese Terlaje, I will recognize you again. Please proceed.
Thank you, Madam Speaker. I move to place in the voting file from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of Edwin J.C. Regis to serve as a member, planning alternate representative of the Guam Historic Preservation Review Board with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Senator Therese, please proceed.
Thank you, Speaker. I move to place in the voting file from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of Sonia L. Siliang to serve as a member of the Guam Memorial Hospital Authority Board of Trustees with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Legislative Secretary Shelton, you are recognized.
Sidus Masi, Madam Speaker. I move to place in the voting file from the Committee on Education, Air Transportation, and Statistics Research and Planning the nomination of Dr. Monique R.C. Story to serve as a member of the Guam Public Library System Board of Directors with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Senator Therese?
Thank you, Madam Speaker. I move to place in the voting file from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of Anita F. Orlino as a member of the Guam Ancestral Lands Commission with the recommendation to do confirm.
On that motion, are there any objections? Seeing or hearing none, motion carries. Senator Terlaje, you still recognized.
Thank you, Madam Speaker. I move to place in the voting file from the Committee on Health, Tourism, Historic Preservation, Land, and Justice the nomination of Ronald F. Eclavea to serve as a member of the Guam Ancestral Lands Commission with the recommendation to do confirm.
On that motion, colleagues, are there any objections? Seeing or hearing none, motion carries. Clerk? Colleagues, we are now going into the bills for discussion. At this time on your agenda, we have Bill number 2-35 LS, and I will recognize Senator Luis Muñoz. You're recognized on Bill 2.
Thank you, Madam Speaker. I move to place Bill number 2-35 LS into the third reading file and discuss it.
Senator Louise, could you please just read the title and the sponsorship, please?
Absolutely, thank you. Bill number 2-35 LS, sponsored by myself, Louise B. Muña, is an act to add a new subsection E to Article 3, Chapter 3, Title 10, Guam Code Annotated, relative to allowing the Department of Public Health and Social Services to implement a school-located vaccination, also known as SLC program, in Guam schools and institutions of higher learning. And before I discuss the body, Madam Speaker, I would like to make a technical amendment, if I can.
Please proceed on the technical amendment and proceed on discussion.
Thank you. The clerk should have received this, and so the technical amendment is basically just to add the subsection into the title. It's an act to add a new, and then we're going to scratch out subsection and put in subsection 3322E. That was just a technical error. We forgot to include the subsection number.
Si Jules Masi, Senator Luis Muña, does everybody have that amendment? If so, are there any objections on the technical change? Senator Lee, I will recognize you. We are on the motion.
Sujus Masi, Madam Speaker, just for the benefit of myself and my colleagues, I'm looking on the second reading file in our Google Drive under Bill number 2-35 LS. Is that where the amendments are supposed to be? I'm only seeing...
It's B2BM.
Is it title? The amendment for the title? Okay. Thank you very much. Got it.
Yes, it is.
No objection.
Thank you. So on that technical motion, are there any objections? Seeing or hearing none, motion carries. Senator Luis, you can proceed.
Thank you so much, Madam Speaker. Madam Speaker, this was the second bill introduced on the very first day of the 35th Guam Legislature. The premise of this bill is very simple. It authorizes GDOE to administer vaccines in their schools. I emphasize that it does not force children to be vaccinated. There is currently a school-located vaccination program at GDOE in conjunction with the Guam Department of Public Health and Social Services and the Federal Vaccines for Children, also known as VFC. That's a program. Now, I know my colleagues may ask, if there's already an existing program, then why is this bill needed? There are two reasons. One, neither GDOE nor Department of Public Health and Social Services have the statutory authority to implement this program. Legal challenges to the program can shut it down. Number two, not all children are eligible for the Vaccines for Children program. The VFC program uses Medicaid and CHIP, Child Health Insurance Program. It's also known as CHIP. It uses the guidelines for eligibility. Now, I've also heard concerns about some of the so-called mandates in this bill. Now, I want to emphasize that there are no legislative mandates in this bill. It is completely optional for GDOE to do any school-located vaccine program. There is no requirement to set up bank accounts or billing systems. Those provisions only exist in the event that GDOE decides to create its own clinics and bill health insurance companies for the cost of the vaccines and the cost to administer them. If GDOE does not set up its own clinics, then there's no need for this. During the public hearing, Madam Speaker, the Vice Speaker expressed interest in the GDOE implementation of a clinic, and the Superintendent John Fernandez also supported this measure as a pilot to begin the opportunity to create one. But in this bill, it's not a requirement. That is something that we can address later on, should we decide to do a clinic at GDOE. Many pharmacies on Guam administer vaccinations. Usually, all they need is an order from a doctor and a valid health insurance card. Some pharmacies do not require doctor's prescriptions. Little effort will be required on the part of school personnel. The bill provides many options for school children to get their vaccinations. Now, I'm not sure why some parents don't take advantage of the coverage available under Medicaid or even private health insurances to get their children vaccinated. I've heard many reasons. They can't miss work. They don't have a ride. There's many different reasons. The bill, when enacted, will make vaccines easily accessible. GDOE has the students, public health has the vaccines. It will not cost GDOE anything from their budget appropriations. Now, Madam Speaker, COVID-19 is a reminder just how important vaccines are. Hopefully, the drug companies will create vaccines that will shield us from this highly contagious and dangerous disease. Now, this bill will make it much easier for our children to get vaccinated without having to miss any more school days. There were many concerns through public health testimony and through BBMR. And if my colleagues would like to discuss it, we definitely could discuss each single item. But at this point, Madam Speaker, I request for the support of my colleagues for this bill. Thank you.
Si Diyos si Senator Luis Munya. On the main motion, anyone else wishing to speak? If Senator Therese Terlaye, I will recognize you at this time.
Thank you, Madam Speaker. The premise of Bill 2-35 is a very good one to effort to increase vaccination by any method, and in this one it is by providing that DOE or that public health will implement school-based programs in Department of Education schools, and the bill also says, I think, in higher learning institutions. But there are several issues with this bill. While I do not object to the intent, the bill, according to BBMR, has fiscal impact, and I'm quoting from BBMR now that says, this proposed legislation is now seeking to mandate DPHSS to provide vaccinations using its resources directly to the students at all school districts of GDOE, removing GDOE from the existing protocol. Such alternative would require DPHSS to hire more professional medical and administrative personnel and to acquire additional technology to administer this program at DPHSS. This requirement could cost up to $1 million or more for such a program. For DPHSS, this would be considered a new program. It concludes, BBMR concludes by saying, quote, in summary, the proposed legislation would require DPHSS to juggle restricted funding resources to cover this proposed unfunded mandate to DPHSS to implement a new program. This is already in existence at GDOE. This bill, as you know, was referred to the Committee on Appropriations, not to the Committee on Education or to the Committee on Health. And it was reported out without any additional funding source. So I believe that at the current time, as we're looking at the bill on the floor, it's still an unfunded mandate as suggested by BBMR. This is on top of the recent shortfalls that we have all acknowledged in the DPHSS budget for FY21, and of course, the increased work that has been placed on DPHSS because of the pandemic. DPHSS has an existing vaccination program. They work with the schools. They work with many partners in the community. They've received 3 national immunization coverage awards from the U.S. Centers for Disease Control and Prevention, Immunization Services Division. These awards were across 3 age groups. Most Improved Coverage Among Children Award, 19 to 35 months old for each of 9 vaccinations from 2013 to 2016. Healthy People 2020 Immunization Award, adolescents aged 13 to 17 years for 4 vaccinations. Most Improved Pneumococcal Vaccination Coverage Among Adults Award, age 65 years and older, 2013 to 2016. Guam is one of 64 state, local, and U.S. affiliated immunization program grantees that are eligible for these awards. There is an MOU currently between Public Health and GDOE that provides the vaccines and supplies to GDOE to administer a program. And per the fiscal note, it's been in existence since FY 2008. And that legislation was perhaps not needed to allow the 2 agencies to work together to provide vaccines. And it may be removing the existing protocol that is at DOE at this time. Currently, DOE is able to provide these immunizations themselves or to make an MOU with any other entity to get that. And I believe, Madam Speaker, that we have seen this done, and we were celebrating it not too long ago when we were able to be together for proclamations for up at the governor's conference room. They have partnered with the Guam Cancer Care, specifically for the HPV vaccination, and it's my understanding that program is working very well. Guam Cancer Care also receives grant funding, and some of it is from our Cancer Trust Fund, and they went out and partnered with DOE to do this. I would just caution against making any additional burdens on public health at this time, particularly one that is unfunded, and seems unlikely that they're going to be receiving additional funds for this type of program at this time. Public Health submitted testimony after the public hearing on this bill. It was several pages long, and they noted a handful of concerns, and I'm only going to point out a couple. They suggested that we revise to have GDOE implement, and this will be in all the schools. Public Health continues to have a severe nursing shortage, and GDOE currently employs more nurses than the Department of Public Health. They suggested we remove institutions of higher learning because they receive limited federal funding for adult vaccinations, thus it will not be able to provide vaccinations to students 19 years and older from institutions of higher learning. They suggested we remove tuberculin skin tests because that's not a vaccine, and that the TB program has limited supplies that are prioritized for testing contacts of known or suspected TB cases. Current Guam law only requires a TCT for a first-time enrollment in any GDOE school or Head Start. They amended their program to mandate a TCT for all GDOE students who will transition from elementary to middle school and middle school to high school. Any additional responsibility should be the responsibility of GDOE. They indicated that on page 2, where it indicates the Department of Public Health and Social Services may bill, that the department's immunization program does not bill, since all vaccines and ancillary supplies are federally funded. Furthermore, private health insurance plan companies will not pay for vaccines when offered by public health. They're asked whether the schools will purchase private stock vaccine for privately insured students. VFC-funded vaccines have strict eligibility requirements. If there will be no private stock vaccine, this proposed bill will only benefit the non-insured and Medicaid-enrolled students. These are the current members who are already covered under public health, Madam Speaker. They've also pointed out where MIP is indicated that if using the vaccine for children vaccines, MIP enrolled children can only be administered these federally funded vaccines at a federally qualified health center or delegated authority. The only federally qualified health centers on Guam at this time are the Guam Community Health Centers, and the only delegated authority is the Department of Public Health Central Regional Health Center. Public Health's CHIP Medicaid program also needs to be involved They need to verify CHIP has money to purchase vaccines. Currently, public health immunization program does not purchase CHIP vaccines. Sorry, Madam Speaker, CHIP stands for the Children's Health Program. They also recommend the GDOE to implement the SLV program and be responsible for the billing and revenues generated. An SLV program is a stepping stone to a school-located clinic that could offer more medical services and generate additional funds for GDOE. Outsourcing to a private accounting firm may negate the revenues generated from the SLV program. They suggested that GDOE enroll as a vaccine for children provider, a VFC provider. Public Health oversees the federally funded VFC program, and there are many benefits to having DOE enroll, or the public school enroll. The GDOE's SLV program could act as a clinic. GDOE will schedule immunization clinics at their time, not be dependent on public health availability. Vaccines will stay at the school, which will always be available for those eligible, minimizing missed vaccination opportunities to eligible children and reduce absenteeism due to missing required vaccinations. When GDOE implements billing for the SLV program, the respective schools can keep its revenues generated from vaccine administration fees and clinic visit fees. The Public Health Immunization Program can assist DOE in meeting compliance for storage and handling. They can provide required digital data loggers, proper transport cooler, and if funding is available, a medical pharmaceutical grade refrigerator. The Public Health Immunization Program can assist at the start of the SLV program by providing medical and ancillary supplies, including syringes, needles, gloves, biohazard bags, sharps container, Band-Aids, and alcohol prep pads. Once revenue is generated through billing for the SLV program, GDOE will then procure the needed supplies. The Public Health Immunization Program will also provide all required forms, including consent forms, shot records, and vaccine information statements. So to summarize, Madam Speaker, and I do have a couple amendments, but I just, while it's a great intention, and I know we're trying to stave off, different actions that are really not before us at this time. What we do have before us at this time, a pandemic, a crisis where public health has really been tested, and we've all been tested, our entire government's response. And I think if we put this, mandate on public health without funding it, that is, first of all, not allowed by law, and second of all, just not fair or wise at this time. And so they've given us an alternative, and that is to suggest that DOE be the one designated to implement this program. And so while I've prepared, floor amendments, and they are on the drive, I believe, to change the program so that it would be DOE instead of public health, I don't believe that DOE has had an opportunity to really look at this and decide whether this is something that they, can take the full burden of at this time. Especially, we know DOE is also, we are still waiting for laptops for children. We're waiting for many, many things to be implemented. And I am, of course, this is a layman's opinion, but I am very confident that the CDC, when there is a vaccine that is released for COVID, that they are going to create protocols for how that will be distributed, because every state is clamoring to know how these vaccines will be distributed, who will be the priority, and that public health will be our lead agency for that, Madam Speaker. And that public health, again, they are doing a good job at getting these vaccinations out with the help of many partners in our community. I guess I'll make the motion in case. Well, I would, let me first try this motion, that I would move that this bill be referred back to the committee, Madam Speaker, in order that the committee consider whether GDOE can take up this purpose instead of public health.
There is a motion to put this bill back into committee, and Senator Luis, do you object?
I object, Madam Speaker, and maybe I could discuss some of the issues that she brought up and talk about it, but I
You
object.
can do so at this time.
Is that a debatable motion?
It,
We're in the motion.
I apologize, Senator Munya, again, verifying with the clerk, this and myself, this motion is not debatable. It is a motion to refer back. Do I hear an objection to the motion? There is an objection. All those in favor of Senator Teresa's motion, please signify by raising your hand. Six, motion fails. Senator Therese,
Thank
I'll
you very
still
much.
give you a floor. You got a couple of minutes.
Thank you, Madam Speaker.
1 minute left.
All right, I'd like to move, there's a floor amendment in the drive. It's for lines 5 through 16 on page 1, to amend section 1 of the bill to read, where it says, where in subsection E, instead of the Department of Public Health, I am deleting that and putting in the words Guam Department of Education. And I am also deleting the tuberculin skin test as recommended by Public Health. So there are two, well, there are several, but, okay, and then further down in the paragraph.
We'll go ahead and work on that motion first, Senator Therese. There is a motion to change the title, and you know what? I'm going to take a minute. I'm going to take a moment's recess because that may change the whole bill in its entirety and may need a public hearing. Moment's recess. Imina 35 na legislatura in Guam is back in session. Senator Therese Terlahi has placed a motion on the floor, and all my colleagues have read it. Are there any objections or anyone wishing to speak on the amendment? Senator Luis Muñoz, I will acknowledge you on the Terlahi amendment.
Thank you, Madam Speaker. And again, I want to thank my colleague for, for her concerns. She did mention this and these concerns at the public hearing. And I just want to reiterate, Madam Speaker, that the bill, first of all, doesn't mandate anything. You can see it in the bill. It says many may include, may implement, may bill. Everything is a may. It's all an option. It's just giving a bigger option for the two agencies to work together because Public Health has the vaccines and Department of Education has the students. It's very simple. At least I thought it would be simple until we got all of the concerns from BBMR. Now, I just want to talk about some of the issues that the previous speaker or the author of the amendment. What this is, the entire statute is permissive.
Speaker, I'm sorry, I'm very sorry.
Do you have a point of information, Senator?
I was cut off when we were discussing the amendment, so I just want to make sure we're discussing the whole amendment as proffered. So there's parts that I have not read into the record yet.
Senator Muñoz, I apologize. I will allow Senator Therese Terlahi to reread the whole amendment onto the floor for discussion. Please proceed, Senator Terlahi.
Thank you, Madam Speaker. The amendment would remove the words Department of Public Health and Social Services and replace those with the Guam Department of Education in two instances. It would remove the tuberculin skin test from being included in this bill as recommended by Public Health because it's not a vaccination. It would remove the words subject to a memorandum of understanding between the Department of Public Health and Social Services and the Guam Department of Education, and instead include the words GDOE may enroll in the federally funded Vaccine for Children program, overseen by the Department of Public Health Immunization Program as a provider. The Department of Public Health and Social Services Immunization Program may assist GDOE at the start of the SLV program by providing medical and ancillary supplies, parentheses, syringes, needles, gloves, biohazard bags, sharp container, Band-Aids, and alcohol prep pads, close parentheses, and may assist in meeting compliance for storage and handling, provided required digital loggers, proper transport cooler, and, if funding available, a medical pharmaceutical grade refrigerator. And the bill would continue to read as it is already. Such SLV programs may be implemented in public schools individually or on a system-wide basis, but delete the words subject to a memorandum of understanding between the Department of Public Health and Social Services and the Guam Department of Education. In other words, this amendment takes Department of Public Health out, except as the overseer of the vaccination program for Guam and the vaccines, and would allow DOE the authority that is intended by this bill, that DOE have the authority to administer vaccines and to apply as a provider to public health for the free vaccines where applicable. Thank you, Madam Speaker.
Thank you, Senator Therese. On the amendment, Senator Luis Muñoz, you are recognized.
Thank you, Madam Speaker. And so I don't have an objection to this amendment. This program is already happening. Public Health and GDOE are already under the Memorandum of Understanding providing the vaccines to the students already. I don't have a problem with giving the onus to the Department of Education where the students are. I really don't have a problem with that at all. And I'm hoping that maybe our colleagues can see that really this bill was simply just to give the legal statutory authority to prevent them from any lawsuits from any anti-vaxxers or anybody who has a problem with their students getting vaccinated in DOE rather than in a clinic. That's really all this bill was for. Now, what we're doing is we're creating now this opportunity for Department of Education to take the onus and allow their students to be vaccinated in the vicinity of any school. And one of the reasons why I disagreed, I don't agree with taking out UOG and GCC, if I can go ahead and just quickly, in subsection 3322, vaccinations and immunizations, A says no student shall be permitted to attend any public or private school, college, or University of Guam unless evidence is presented to the enrolling officer of such school, college, or university that the student is free from any communicable diseases. And so that's the reason why we included the institutions of higher learning, because it's already in the statute. If we wanted to exclude it, then they don't necessarily have to. They don't have to go to UOG or GCC, but it's already in this statute. So I disagreed with taking that out. Not to mention, Madam Speaker, that there are some students that are under the age of 19, so maybe they still will qualify for the Vaccines for Children program. So why should we take it out of this opportunity? Why should we take that opportunity out? Really what this bill is doing is it's just providing many different options for opportunities for our students to get vaccinated. And there's nothing in the bill that says shall, everything says may. Now, I don't disagree with the fact that we could change the onus from Department of Public Health to the Department of Education. Even the superintendent at the public hearing said he would love it because this will act as a pilot for them to start exploring the opportunity to create clinics for them to provide these vaccines for the students at each individual school. Now, if this amendment is going to allow Department of Education to create those schedules so that they can coordinate it with Department of Public Health and say, do you have these vaccines available because we have these many consent forms. Now, mind you, we have to be reminded that students cannot get vaccinated without the consent of their parents. So these consent forms have to be signed and delivered to the schools to be delivered to public health to know exactly how many vaccines that they're going to need to bring to the location. So let's be reminded that nothing is forcing anybody, any of these students to get vaccinated. Now, if GDOE can create the scheduling, if that's the way we're going to allow that to happen in this amendment, then, Madam Speaker, I'm in support of this amendment, changing it from the Department of Public Health to the Department of Education so that they can create that schedule so they can coordinate with Department of Public Health. I'm okay with that. Thank you, Madam Speaker.
Senator Muñoz, anyone else on the amendment? Anyone else? If not, Senator Lee, you are recognized on the amendment.
Sujasmasi, Madam Speaker, in reviewing the committee report for this bill, I am seeing that the superintendent of DOE was present. So I just wanted to maybe ask I'm not sure if it's the proffer of the amendment or the sponsor of this bill, but do we have a reasonable understanding that the Department of Education has had an opportunity to weigh in on a change like this?
Thank you, Senator Lee. Senator Muñoz, would you like to chime in? Would you like to yield?
Yeah, if the mover of the amendment wanted to make but I'll just make a comment that in the amendment, it didn't change the last line of that section that says such SLV programs may be implemented in public schools individually on a system-wide basis. So again, it really is still permissive. It's an option, but we're just changing Department of Public Health's onus on it to Department of Education.
Thank you, Senator Muñoz. Senator Therese, would you like to chime in? Would you like to hear from Senator Therese Senator Lee? Yes. Would you like to yield?
Sure, Madam Speaker. I think the
Thank you.
question was whether DOE has had an opportunity to review this amendment. Not that I'm aware of, although I did raise these issues at the hearing. But we did not have public health testimony at the time because they were not, to my knowledge, invited to that hearing. Like, this is a huge, I mean, you know, to shift it's a big change in policy. So I don't know DOE's full position on it. I only know what they said at the public hearing. And as the proffer of the bill stated, DOE is one of public health's partners at this time. They partner with public health. In fact, public health's immunization rate for students is 100% except for the 35 students who have applied for an exemption, either religious or medical. Very few students, because we have mandatory vaccination program. So the bill is not going to increase vaccination in our schools because we've got compliance. What it's going to do is allow providers to come in, such as the Guam Cancer Care, this was stated in the committee report, to come in and provide vaccinations that are not right now mandated by public health. So there's a big difference, Madam Speaker. So for the vaccinations that are covered, mandated by public health, they are doing an excellent job of making sure that everybody gets vaccinated in time for schools, I think, with their partners, of course, with many partners. And it's a community-wide effort at that time.
Thank you, Senator Therese. Senator Lee, you still have the floor. Thank you very much. Anyone else on the main motion, on the amendment? If not, is there an objection to this? Hearing none. Motion carries. Senator Therese, did you have another amendment?
Yes, Madam Speaker. So the other amendment is on page 2, lines 1 through 16. All right, so I'm going to read the words that are being deleted. We are deleting the words, "to the extent allowable and practical, the Department of Public Health and Social Services may bill any health insurance plan or company, Medicaid and MIP, the Child Health Insurance Program, or any other party providing coverage for which the child is covered for the cost of vaccines, immunizations, supplies, to administer vaccines, immunizations, and the administering of the vaccines, immunizations. The Department of Public Health and Social Services is not permitted to bill any party for any vaccines or supplies that were received through federal programs or donations where the acceptance of such vaccines and supplies prohibits such billing." And we are instead putting in the words, "The Guam Department of Education shall implement billing for the SLV program and shall retain all revenues generated from vaccine administration fees and clinic visit fees. GDOE shall bill Medicaid using Medicaid's fee code. As an enrolled VFC provider, GDOE shall charge non-insured populations an administration fee of no more than $23.11 per vaccine. Revenues shall be used, well, we include revenues, and then shall be used to cover the cost of, instead of the Department of Public Health, we're striking out public health. And so that those are the initial changes in this section, and then further down, it removes the words, "or may be outsourced to a private accounting firm." It deletes that section because if DOE is going to implement this, then I would like them to keep as much of the revenues as possible.
Thank you, Senator Chalayi. On the amendment, Senator Louise, you're recognized.
Madam Speaker, may I just take a short recess just to review over again? Thank you.
Thank you, colleagues. We are at 11:45 right now. We'll go ahead and take a lunch break till 2:15 this afternoon.